Hello and welcome. Today we're diving into the intricacies of a specific heart condition, sinoatrial node dysfunction, often abbreviated as sinus node dysfunction or SND. It's a condition that affects the heart's natural pacemaker, potentially disrupting the rhythm of your heartbeat. Understanding SND is crucial for both patients and anyone interested in cardiovascular health. Let's get started. So, what causes sinoatrial node dysfunction? In many cases, the exact cause remains elusive. However, several factors can contribute to its development. These include aging, as the sinoatrial node can naturally degenerate over time, heart disease, such as coronary artery disease, heart failure, and valve disorders, can also damage the node or its surrounding tissues. Certain medications, including beta blockers, calcium channel blockers, and digoxin, can suppress the sinoatrial node's activity. Furthermore, inflammatory conditions like rheumatic fever and infections, as well as infiltrative diseases like amyloidosis and sarcoidosis, can impact the node. Finally, in rare instances, genetic mutations may play a role. Now let's explore the pathophysiology of SND. The sinoatrial node, located in the right atrium, is the heart's natural pacemaker. It generates electrical impulses that initiate each heartbeat. In SND, this node malfunctions. It may fire impulses too slowly, irregularly, or not at all. This dysfunction disrupts the heart's normal rhythm. The heart may compensate for this by having other areas take over pacing functions, but these alternative pacemakers are generally slower and less efficient. This can lead to bradycardia, which is a slow heart rate, or other rhythm disturbances resulting in various symptoms. When we talk about epidemiology, SND is not uncommon, particularly in older adults. The prevalence increases with age as the sinoatrial node is susceptible to age-related degeneration. It's estimated that a significant percentage of people over the age of 70 may experience some degree of SND. Men and women are affected relatively equally. It's important to note that these are general trends, and the specific numbers can vary depending on the population studied and the diagnostic criteria used. What are the signs and symptoms of sinoatrial node dysfunction? The symptoms can vary widely, ranging from mild to severe, and some individuals may not experience any symptoms at all. Common symptoms include fatigue, dizziness or lightheadedness, fainting or near fainting spells, shortness of breath, chest pain or discomfort, palpitations, a feeling of fluttering or racing heart, and confusion or memory problems, particularly in older adults. Slow heart rate is often associated with many of these symptoms. The absence of symptoms doesn't necessarily mean the absence of the condition, so a thorough evaluation is important. How is sinoatrial node dysfunction diagnosed? The diagnostic process typically involves a combination of tools and assessments. An electrocardiogram, or ECG, is the first-line test, recording the heart's electrical activity. However, since SND can be intermittent, a standard ECG may not always capture the dysfunction. In such cases, longer-term monitoring, such as a Holter monitor or event recorder, might be used to continuously record the heart's rhythm over a longer period. An electrophysiology study, an invasive procedure where catheters are inserted into the heart to assess the electrical activity of the sinoatrial node and other areas, might also be necessary. Doctors will also take a thorough medical history and perform a physical examination to rule out other potential causes. Sinoatrial node dysfunction can be classified into several types based on the specific rhythm abnormalities. Sinus bradycardia, where the heart rate is consistently slow, is one type. Sinus arrest or pause occurs when the sinoatrial node fails to fire for a period, resulting in a pause in the heart rhythm. Tachycardia, bradycardia syndrome involves alternating periods of rapid heart rates and slow heart rates. Finally, sinoatrial exit block happens when the electrical impulse generated by the sinoatrial node is blocked from reaching the atria. These classifications help doctors understand the specific nature of the dysfunction and tailor treatment accordingly. The primary treatment for symptomatic sinoatrial node dysfunction is a pacemaker implantation. A pacemaker is a small electronic device surgically implanted under the skin, usually near the collarbone. It monitors the heart's rhythm and provides electrical impulses when the heart beats too slowly or irregularly, ensuring a consistent and adequate heart rate. Medications that may be contributing to the dysfunction, such as beta blockers, may need to be adjusted or discontinued. Regular follow-up appointments with a cardiologist are essential to monitor the pacemaker's function and adjust settings as needed. Lifestyle modifications, such as avoiding excessive caffeine or alcohol, may also be recommended. While it's not always possible to completely prevent sinoatrial node dysfunction, there are steps you can take to reduce your risk. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, can help protect your heart health. Managing underlying conditions like high blood pressure, high cholesterol, and diabetes is also crucial. If you're taking medications that can affect the sinoatrial node, discuss the potential risks and benefits with your doctor. Regular check-ups with your healthcare provider can help detect and manage any potential heart problems early on. The prognosis for individuals with sinoatrial node dysfunction is generally good, particularly with appropriate treatment. Pacemaker implantation can significantly improve symptoms and quality of life. However, the underlying cause of the SND and the presence of other heart conditions can influence the overall prognosis. Recent research is focused on developing more advanced pacing technologies, such as leadless pacemakers and physiological pacing, which aim to better mimic the heart's natural electrical activity. Additionally, researchers are exploring the potential of gene therapy to repair damaged sinoatrial node tissue. As our understanding of SND continues to evolve, we can expect further improvements in diagnosis and treatment in the future. Thank you for joining us today.